Yeah, yeah. Whatever it is, well, takes a lot.
Yeah. Well, Corneo likes them paralyzed too.
Really?
Yeah. I don't know.
One, they don't get it, they just back you enough.
I know.
Hello.
Happy and out of the crack.
Dr. Boom Boom Pow is performing surgery right now.
Yes. Holy cow.
We are live on YouTube, so you can go check us out over there if you'd like to see him at Dr. Genevieve Plastic Surgery.
Okay.
Does he specialize in BBL revisions? Yes.
Yeah, good case by June. Not bad. Not bad, eats all.
Yes, ma'am. Dr. Boom Super Pow. Thank you, Jason. That's so sweet.
Should take 5 hours. Any of those mommy makeovers?
All right. Thank you guys for joining us. This is our last surgery of the day. We are doing a reconstruction of the breast implant today.
Oh, don't stop believing.
And doing lipo around the interior bra.
Bra line, where your fat pokes out of the bra. Women hate it. Matter of fact, this lady said, in no unspecific terms, that she's more happy about the lipo of the interior bra than the revision of her breast.
Oh, wow.
I was like, really?
Yeah, because when she wears a skin tight
Yeah,
bra,
you can see the
you
puffing
can
out
see her
here.
pocket, yeah.
Okay.
So she said that, I was like, what? I've never heard that before.
Miss Lacey asks, where are you located? We are located in San Antonio, Texas, in the Stone Oak location. So that's northern San Antonio. We operate here Monday through Thursday. And we operate at Maximus Surgery Center.
Yeah.
And you're on Dr. Barlow's TikTok. If you click the link in his bio, it's going to take you to a link tree, and it's going to provide all the different places that he performs surgery. So he operates in Houston and he operates here in San Antonio. So if you're closer to either one, we can definitely have you fill out a form and schedule a consultation if you're interested, and book an appointment, a virtual consultation, you name it.
Like, I did anesthesia for Nazarian. My 600-pound life.
Oh, you did?
Yeah.
Hope y'all are having a great Tuesday. This is our last surgery of the day.
No, you.
We were live for 3 of our other ones.
I like what he says to them.
You never see me.
I know, dude.
We've been here since 5:30 this morning.
I mean,
And we are live on our YouTube today, so we are showing this surgery happening. The patient consented to that today. Sometimes the patients will like to go back and actually re-watch the surgeries that we perform and just watch it for themselves, or sometimes like their family will want to make sure, or they're curious to see how it's going. And so we are live on YouTube at Dr. Jeneby Plastic Surgery. If you're interested in watching it over there, you'll basically just see what I'm saying. So it's really interesting. And again, our patients do consent to it.
Oh, yeah.
Very like.
He's very laid back, very nice.
But he still so he's not calling you a diet, that's why you want to.
Yeah.
You're like, damn.
Oh, thank you for sharing the live. We appreciate it.
So sensitive. When he's doing the laparoscopic procedure.
Hope y'all are having a great Tuesday.
It's like, I still have like no twitches on my body.
We are live on Dr. Barlow's TikTok at Dr. Rocket. And we are also live on Dr. Genevive's TikTok at Dr. Boom Boom Pow.
But he is so funny.
So check either page out if you're coming from one or the other.
What?
When you first followed us back there, it's they released the one last week, but they didn't think I was going to reevaluate. I can
Give me a second. Tell him like, you know, maybe.
Again, we are doing a breast reconstruction, so we are removing old implants and replacing them with new ones. And we are also doing lipo of the interior bra strap. So like where that fat pokes out around your bra line, we are doing lipo in that area. Guys have any questions about today's procedure? Feel free to comment them.
Yeah, that's our game. That's our name.
Billy Bob says, my sister interned there a little while ago, said she loved it there. Well, good.
Salty.
I'm glad. There were some girls yesterday, I believe, actually, that are UTSA students, or one was from UTSA, one was from, I think it was like Our Lady of the Lake, maybe? I'm not sure. But they were here, they want to be future doctors, and so they were just shadowing Dr. Jeneby, and it was just really interesting to meet them because they were so young and so like enthusiastic. So it's really cool that your sister got to do that too. I'm curious, did she go into the medical field?
Let's do it. What do you want to guess this one is? 550 also?
Hi everybody, thanks for joining us today. Again, we are doing a breast reconstruction, so we are taking out old implants and replacing them with new ones. And then we are doing lipo around the interior bra strap, so where like that fat kind of flops or like pokes out around the bra strap. We're just removing that fat. Hello, thanks for joining us. And we are live on YouTube as well. So if you want to see the surgery happening, like what I'm seeing exactly, you can hop over on our YouTube at Dr. Jeneby Plastic Surgery. And we are live there, and we are also live on one of our other doctors' TikToks, although he's not operating right now. He's not here today, but we just wanted to give his following a chance to ask any questions as well. All right. Yes, she wants to do something related to that, and since Dr. Jeneby is our cousin, he offered. Oh my gosh, wow.
What did you say?
Billy Bob?
Billy Bob is my cousin?
He said, okay.
Billy Bob's bits?
I don't know.
Billy Bob is my cousin?
Billy Bob 15901. It's Ashton, he says. Do you have a cousin named Ashton?
Bro, hold up. Sounds a little suspect.
I don't know, Billy Bob.
Billy Bob Ashton?
Billy Bob is his user.
McKenna, I think he's playing a game on you, man.
You're probably right.
McKenna, does it look like I have a Billy Bob
Jeneby wears an omelet of his blood on his necklace.
What?
Very chest, man.
Emily was an intern? Was she an intern, Emily? Does that ring a bell?
Great Scott. They're messing with you so hard.
Oh my god. Leave me
You're
alone.
the fresh catch right now. They're messing with you hard.
Okay.
Yep. It's okay, McKenna. It's all right. That means your love.
Okay.
Okay.
Doo-doos. You doo-doo heads.
You're mean. I'm just kidding.
Me.
Okay.
McKenna's like,
Well, that's a little embarrassing.
McKenna, you like this? Freddie was like, you like this?
Okay, Katie asked, what operation is happening? Great question. Today we are doing a breast reconstruction today. So we are removing some old implants that our patient had. And we are going to be replacing them with some new ones. And then we are also going to be doing lipo on our patient's interior bra line. So that fat that kind of like falls over the bra line, if that makes sense. Like if you're wearing like a tight shirt or a tight blouse or like a dress or something, and you see that fat kind of like poking out, like sticking out of the bra, that's where we're doing lipo today, to make it just smooth and seamless. Great question. How many operations are happening in a day? So it usually just depends on what kind of procedures we have. Like today was a really busy day. We most of the team got here around 5:30, 6 o'clock, and we had our first surgery around like 6:10. So, and we had 5 surgeries scheduled today, and this is our 5th surgery. So this is our last one for the day. So it's kind of a lot today, but some days, like this week, we only had like 1 surgery, and sometimes they consent to social media, and sometimes they don't. So sometimes you guys aren't seeing that surgery. But on days like today, we had 5. Sometimes it's 1, sometimes it's 2, sometimes it's 3. It just kind of depends. We also have other doctors that will like reserve a room to operate in at our surgery center. So, but Dr. Jeneby had 5 surgeries himself alone today. Dr. Phillips helped a little bit on 2 cases. So I hope that answers your question. Feel free to ask any more. And we are live on Dr. Barlow's at Dr. Rocket on TikTok. And if you just want to give him a follow, check out what he's got going on, you can follow him at Dr. Rocket on TikTok. KDW, very cool. I'm a nurse. That is awesome. What kind of a nurse? An RN.
RN.
We are also live on our YouTube, so if you guys want to see a better view as to what we're doing, go ahead and hop on over there at Dr. Genevieve Plastic Surgery. So you'll see basically everything I'm seeing, and you'll see Dr. Jeneby operating as well with his assistant. Thanks for joining us, guys. Hi, everyone. Hope everyone's having a good Tuesday.
McKenna, you know who sang this song?
Just because I'm Gen Z doesn't mean I'm uncultured. Yes. Journey, right? Okay.
That's exceptionally good.
That's not even a hard one.
Not that young.
Yes, she is. She's Gen Z, bro. That means she was born in the 2000s, right?
Yeah.
That means after Y2K you were born. And I was a...
I remember that shit.
we all thought the world was going to end. And computers were going to go down.
Again.
Life was going to suck.
Again, for those of you who are just joining us, we are doing a breast reconstruction. So we are removing some old implants and replacing them with new ones. And then we are doing lipo around our patient's interior bra line. So that fat that kind of like folds over the bra or like sticks out when you wear like a tight garment. We're doing lipo in those areas today. Pretty interesting procedure. We had 5 surgeries in total today.
Maybe she knew because you said played basketball.
Maybe. Did you hear me say...
I didn't hear anything. Stop. Who said that?
John?
Billy Bob?
Billy Bob, Genevive's cousin.
Oh my gosh. Leave me alone.
What?
How long to wear support post-op garments, weeks or months? Let me ask. That's a great question. Dr. J,
Yes.
How long do you have to wear support post-op garments? Weeks, months?
I like at least 3 months, would like to see 6, and the best would be up to a year. Some people wear them because they're just comfortable to have.
Okay.
Because the nerves are supported.
Oh, okay.
So the nerves feel better in a garment.
Okay.
It's kind of
So,
like, yeah, if the nerves are moving around too much, it hurts.
yeah,
When
okay.
they're supported by a garment, they tend to feel better.
Okay. You caught all of that. All right. Awesome. Great question.
Yes, that was good.
So you said it helps support the nerves.
Yeah, and it's less painful. It tends to
Less painful
reduce a little bit of the swelling.
and helps reduce some of the
Also,
swelling.
Time really is the swelling reducer. Over time, your swelling will just get better.
Got it. Feel free to ask any more.
That's right. I don't really evaluate somebody until 1 year.
Yes, of course. And I see you're from Dr. Barlow's page. Tell him Gen X is the best generation. LOL.
Probably not.
No, I'm just kidding. I'm Gen Z, so I have to stick up
You
for.
gotta represent.
Yeah, I gotta represent.
You know what she told me in the kitchen, dude? That's totally Gen Z. I was saying something about her. She's like, thanks for putting me on blast.
Oh my
I was
god.
like, what? What does that mean? Yeah. You go home to your kids when they're giving you stuff, and you're like, thanks for putting me on blast, man.
It's like you're grilling me, like
Yeah,
you're putting me on the
grilling me.
spot.
Oh, well, that's it.
We're only as old as dirt, not in the dirt.
Yes, not yet.
Oh gosh.
We love it. We love you Gen Zs. Makes us feel better about ourselves.
Okay. Weird. No, I'm just kidding.
Not a compliment. Not a compliment, girl.
For those.
Everybody in Gen Z wants to be a manager and they want to work from home. Immediately out of whatever.
An influencer.
Yeah, I'm going to be an influencer.
Yeah, that's it.
Okay.
All right. For those of y'all that are just hopping on, we are doing a breast reconstruction today. So,
We're going to be finishing up here soon.
okay. So we are finishing up that breast reconstruction. So we just removed our patient's old implants and added some fresh, clean, new ones. And then our patient also is going to get lipo on the anterior bra line. We're gonna come back here in a few minutes, but I'm gonna
Getting old, dude.
hop off here in just a second. So tune in later for more procedures that we have going on this week. And again, we are live on Dr. Barlow's page as well at Dr. Rocket on TikTok. So y'all can give us a follow over there. Just check him out. He is not operating with Dr. Genevieve, but he's one of the surgeons that often operates here at our surgery center in San Antonio. And so we just wanted to allow anyone from his following, anyone from his page to answer, or excuse me, ask any questions while Dr. Genevieve was on live, while Dr. Barlow's not here. Just to like, just go show him some love. This is what I'm trying to get at. But we are gonna close up here shortly. But if you guys have any questions, feel free to comment them. It's a pretty seamless procedure. They're just stitching up her breast right now where they put the implants in. And to get a look at the last few minutes of the surgery, you can hop on our YouTube.
What?
Yep.
Did anyone get hurt?
No, just the cars were all automatically controlled, radio
And?
controlled, yeah.
But
But the
Miss
real
Priscilla
passion-
asks,
the real drive
how is
for
replacing
sitting
implants
in
considered
the other part that has
reconstruction
computers
or
in it.
doing the lipo as well makes it that?
that's crazy.
Yes, ma'am. So that's
It
what
is.
kind
What
of
did they
ties it
find
all
out?
together as a breast reconstruction because we're taking out what was once there and putting in something new. So it's just like reconstruction because we're taking out and replacing. That's all. And then of course with the lipo, our patient had made a comment about being more excited for her lipo around the interior bra line, so where like her bra sits and that fat surrounding the bra line that pokes out sometimes. She was more excited to get the lipo done than the actual reconstruction, so getting those new implants put in, which I thought was really interesting because you would think the opposite, right? But
Whoever thought we had that problem.
it just kind of ties the whole look together, I think. It makes it look more
Over the
slim.
moon, but don't watch out for
Great question, by the way.
Yeah. So they want to launch from the moon.
Yeah.
Moving forward.
Feel free to ask any more questions if you have them.
Yeah.
We'll be live for just a few more minutes here, and if you want to catch the last few minutes, like what I'm seeing, you can go hop on our YouTube at Dr. Genevieve Plastic Surgery.
You leave from the moon, there's no gravity.
We are allowed to show the patient and the surgery and the operating table.
Yeah, so
We just can't show that on like TikTok and Instagram and Facebook, just because it's harder to, I guess, filter that out from reaching kids, and obviously we don't want kids to see that. But on YouTube it's a lot more strict.
Yeah, I mean, where it goes into space, I guess. Doesn't get captured by the. That's gonna be more.
Hi, thanks for joining us on Dr. Barlow's end. Hope y'all are doing amazing. Dr. Barlow is not operating today. We are live on his account just to kind of get some more exposure and to allow any of y'all on his side to ask any questions you may have about any of the procedures that we do here. Dr. Jeneby today is doing a breast reconstruction, so removing old implants, draining those, and then adding new ones, and then later he's going to go in and do lipo around the interior bra line. So if you guys have any questions on Dr. Barlow's side, feel free to ask them. Dr. Barlow does operate here in San Antonio with Dr. Jeneby sometimes. We are live on Dr. Geneviev's page as well. Dr. Boom Boom Pow can give us a follow over there as well. And we are on Instagram, we are on TikTok, we are on YouTube. And I do have a form pinned here on Dr. Geneviev's live. If any of y'all were interested in filling that out, it is free. It's just going to help us get all your information collected and have the right people reach out to you if you have any questions about any of the procedures that we do here, or if you're interested in any operations, we can set that up, like a virtual consultation, an in-person.
Oh, I had to come in here. Oh.
We can get you in contact with the financing team, our sales team, all of that.
Rio yellows. Rio yellow fast absorbing.
Alright, guys.
No, plain good.
Plain gut. Is
Yellow.
that yellow? Right there? Yeah, that's zero, that one. Perfect.
Hey, everyone.
Plus one. Sorry, man. Had to release this. Yeah. Face bro. Really don't need that much for these R&Rs. Maybe 10 cc. Yours?
We are going to be finishing up here very quickly.
And a count?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14.
Thank y'all for joining us.
1 quart screw, 1 hypo.
Again, this was our 5th surgery of the day. It was a breast reconstruction. So we took out some old implants, replaced them with some new, and then we did some lipo around the interior bra line to kind of just make her look more slimmer around her bra, and so that stubborn fat that likes to peel over a bra whenever you wear like a tight garment and it pops out a little bit. We took care of some of that.
I think they ever said I was, 100% organized.
All
Why
right.
I do this? We have another one.
We are going to wrap it up, y'all. Thank you so much for joining us. And again, if you're interested or you know of somebody who's interested, you can share our page with them, or you can fill out a form that we have pinned here on our screen, or you can click the link in our bio and you can find that form there. If you're having trouble finding it on our page, and you can fill that out. We can set up a consultation, a virtual consultation, and we can figure out pricing. Hope y'all have an amazing Tuesday, and we will see y'all soon. Bye.
We took out like 500 on the left and saline.
Oh, right there.
She wants to know how much came out.